Hi everyone. Today we have Dr. Kavitha with us to share her knowledge on elder health issues. Hi doctor.
Hi, Dr. Revati.
Please introduce yourself.
Thank you. Hello, everybody. I'm Dr. Kavitha S. Manjunathan. I have pursued DNB family medicine post my MBBS degree, and I have 17 plus years of experience in my medical practice. I'm serving as clinical head here at Portea.
Doctor, we have seen commonly elder citizens complaining of various health issues like sleeplessness or lack of urination control, and sometimes they won't even have orientation regarding what's happening around them. Why this happens to them?
Okay, good question, Dr. Revati. Let me start with the good news. People nowadays are continuing to live longer lives. So this is a good news. But the bad news is the longer lives comes with a cost. Now, as we age, we are likely to develop many health problems. So these various health problems which commonly occurs or which specifically occurs in older people is called the geriatric syndrome, which usually has more than one cause, and it can affect many parts of the body of an elderly person. So this is a common clinical condition which does not fit into a specific disease category, and it can have substantial implications on quality of life and life satisfaction in older adults.
So doctor, is there a way we can help them?
Yes, luckily we have many treatments and many ways available for these conditions to help elders promote their independence and quality of life, especially in elders, those who suffer from these various health issues, the so-called geriatric syndrome.
Doctor, can you please explain in detail regarding this?
Okay, let me talk to you the 7 most common geriatric syndrome, and let's have a closer look at it for better understanding, and I will also let you know certain tips to manage these various common health issues. The first common syndrome is bladder problems. Lack of bladder control or urinary incontinence or unintentional passage of urine. This is urinary incontinence. Now, this is a very embarrassing situation for elders when they suffer from this. If you're suffering from these symptoms, more than 50% of older people are diagnosed with urinary incontinence as per CDC, the Center for Disease Control and Prevention. Urinary incontinence, if left untreated, it can lead to falls, injuries, and isolation. But while incontinence increases with age, it doesn't mean urinary incontinence is an inevitable part of aging. Do not hesitate if you suffer from this issue. Please talk to your doctor, your healthcare provider, and you can get treated for this. There are several treatments available like medications, special devices, medical procedure, and surgeries. Especially caregivers, you should, when you get to understand if your elder one, your aged loved one is suffering from lack of bladder control, their intervention exists where you can help them to overcome this situation.
Doctor, we have seen many of them complaining of sleeplessness, and even the same person might be dozing off on chair during daytime. How can we help them with these sleep issues?
Okay. So this is sleep problem. This is the second most common geriatric syndrome is the sleep problems. Most elders complain difficulty falling asleep, and this is insomnia. Insomnia is a common clinical condition where the elderly has a persistent difficulty falling or remaining asleep despite the opportunity to do so. People with insomnia experience excessive daytime sleepiness and other cognitive impairments. That's why you see them dozing off in their chairs. People aged 60 and older are susceptible to develop insomnia, and there are multiple risk factors that could cause insomnia. The seniors are at a higher risk of developing medical and psychiatric issues leading to insomnia. Other various risk factors causing insomnia are increased medication usage, the advances in endogenous circadian clock. Now, this sleep problems in elderlies can affect the quality of life, can lead to falls, injuries, and other health problems. So, elders, if you have trouble falling asleep or if you have daytime sleepiness, please talk to your healthcare provider or your doctor so that the type of sleep problem can be identified and treated.
Doctors mentioned in the beginning, we have seen elder citizens in a state of disorientation, or they has confusion, and sometimes they won't be able to concentrate even for shorter period of time. So is this something which require treatment? Is it a mental issue or a physical issue?
Okay, so I think you are referring to something called delirium. Delirium is a common and serious complication in elderly. Prompt treatment is essential to help the older people recover from delirium. So, caregivers, you, your friends, and family should know the signs and symptoms of delirium, and you should seek medical attention right away from as soon as you see the start of mental confusion in your aged loved family member. The next common health problem is dementia. Dementia is simply a memory decline. It's a state of memory decline along with other mental health abnormalities sufficient enough to decrease the ability to do your usual tasks. According to Geriatric Society, 7% of older adults are diagnosed with dementia. Along with problems of memory, language, decision-making abilities, there could be changes in mood like increased irritability, anxiety, and depression. They could also have changes in personality and behavior. Alzheimer's is the most common form of dementia. There are other types of multiple types of this type of memory afflicting condition. There is no cure for this condition. There are treatments which can help address symptoms and the behavioral problems such as medication, occupational therapy, physical therapy, modifying the environment, and modifying certain tasks. Many people fear that a diagnosis of dementia means end of life, but this is not true. There are many tests to diagnose if you or someone you care might have dementia and what type it could be. So there are treatments which can help improve the condition and slow the disease progression. So there is profound benefit in early diagnosis of this condition, including access to treatment, access to advice, access to medications which can slow down the progression of the disease, and also much time to prepare for the future. So caregivers, if you notice some sort of memory decline in your loved elder one, which is hampering his or her daily tasks, please talk to their doctor or healthcare provider so that it will help in early diagnosis of the condition and will help slow down the progress of this condition.
Doctor, we have seen a lot of elder patients who are bedridden as a consequence of fall they had. Why this happens to them?
Okay, the next most common health issue in elderly is falls. Falls is a leading cause for mortality, morbidity, and disability in elderly. You see, more than half of older people aged 65 and above fall every year, and 1/3 of them have a recurrent fall. But their risk of falling doubles and triples in those who have history of previous falls and in presence of cognitive impairments. So falls are a leading cause of serious injuries in elderly. There are multiple risk factors causing falls, including the safety hazards at home, weakness, vision impairments, dizziness, arthritis, and malnourishment. Elders, tell your doctor immediately when you've had a fall. They can look into what caused the fall and they can suggest treatments in order to prevent future falls. There are many treatments like exercise, physiotherapy, which can help improve your gait, balance, and prevent further falls. If you're a caregiver or if you're caring for someone who has had a fall or you feel he's in a danger of falling, please talk to his or her healthcare provider and doctor to identify the cause of this fall, prevent the falls, and they would help them get into physiotherapies like exercise, physical training, improve the gait and balance so that they don't succumb to future falls and fractures.
Even though they are not very physically active, they are much prone to fractures. What is the reason behind this?
Okay, this condition is called osteoporosis, the next common health problem in elderly. Osteoporosis is a bone disease in which the body loses much bones or makes too little bones, also called thinning bones. Now, bone is a living tissue that is constantly being broken down and replaced. Now, osteoporosis occurs when the making of new bone is not up to the mark. It is not according to the lost old bones. So, osteoporosis, in this condition, the bones become very fragile and brittle, so brittle that even a fall or a mild pressure like bending down or coughing can fracture a bone. So women and men of all races are prone to develop osteoporosis, especially older women post-menopausal are at a higher risk of developing osteoporosis. So women at 60 and above and men 670 and above should get their bone density mass testing done. Elders, you might want to talk to your doctor regarding osteoporosis if you have undergone an early menopause or if you have taken corticosteroids for a long time at any point of your life, or any one of your parents have had hip fractures. Good nutrition, increased calcium intake, increased vitamin D intake, along with strength training exercises and weight bearing exercises like walking and other exercises would help improve your bone density and bone strength. Caregivers, you could help your elders in order to tackle with the osteoporosis by increasing their diet, which is rich in calcium, vitamin D, help them join strength training exercises, weight bearing exercises and walking. So this will help prevent osteoporosis.
Doctor, is there anything to add up than these health issues which we have mentioned?
Yes, I would want to add up the 7th most common geriatric syndrome or the common health issue, that is a weight loss. Weight loss is a common problem in older people. At the age of 65 and above, it is common to lose about 0.2 to 0.4 pounds or 100 to 180 grams every year. But unintentional weight loss can be potentially dangerous if you have lost 5% or more in the last 6 to 12 months. Weight loss can be caused by diminished sense of taste sensation, and it could also help us to suggest that there is something underlying serious health problem causing weight loss. No matter what the cause is, weight loss can be a risk factor to develop multiple infections and other weakness and bone diseases. Your healthcare provider or your doctor should weigh you at your each physical visit, and also check for your changes. Make sure your healthcare provider is informed about any changes in your weight or changes in your appetite. If you are a caregiver, make sure that at your every physical visit for your aged loved one, the weight gets checked, and if any changes are there, that too gets informed to your doctor. Now, you can make multiple changes to your elderly in order to prevent weight loss by incorporating a meal which is more appetizing and enjoyable. Also incorporate some physical activity to boost their appetite. Also, even check their medications. If there are any medications which is causing nausea, dry mouth or loss of appetite or even swallowing difficulties, please talk to the doctor and help knock out those medications. This will help prevent weight loss. Even a mere act of joining the elderly for a meal can make the meal more enjoyable and appetizing. Thank you, viewers, for allowing me to share my knowledge on dealing with the common health issues of the elderly.